Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Welcome to the show. We meet every Saturday at 10:30 a.m. Central Time, coming to you live on YouTube, Facebook, and X. I got to get my pointing going the right way. But anyway, welcome to the show. If this is your first time checking us out, be sure to go to our website at uropatient.com to learn more about the show. Best place also to see all of our past episodes. They're all up there. And we got some handy dandy handouts for you. So you want to make sure you take advantage of those. Check those out too. So today I've got a great episode for you. We're going to talk about a question I seem to get an awful lot of. And that's when somebody goes through an operation like TUR, the prostate, or anything to relieve blockage of the prostate. And they all of a sudden find out they can't urinate. They can't pee. So let's find out, why can't I pee after surgery? So I get this asked quite a bit, and so I thought I'd do an episode about this. It's a common yet often concerning issue after prostate surgery. You just had an operation because you couldn't pee, and you still can't pee. They take the catheter out, and you're still not able to urinate. So we're going to explore why it happens, how long it can last, and what can be done about it. So urinary retention occurs when a person cannot empty their bladder completely. After prostate surgery, this issue can be temporary, hopefully, or in some cases persistent. So let's take a quick look at how this can happen. So the prostate plays a crucial role in urinary function by surrounding the urethra. When it's removed or treated surgically, sometimes swelling and nerve disruptions can temporarily impact urination. Different types of prostate surgeries have different impact on the urinary system. There are all different ways that they treat this blockage. The old common back in the day procedure was the TURP, the transurethral resection of the prostate, where they scraped out that blocking tissue. They can even do a radical prostatectomy, which sometimes is done for cancer therapy, where the whole prostate is removed, or sometimes for a blocking prostate, it's so big they do what's called an open prostatectomy, where they remove the blockage tissue from the inside. And more commonly now, we do what we call these laser surgeries or minimally invasive surgeries, which may even be done in the office. All are used to remove blocking tissue. Now, each can lead to urinary retention post-operatively. So after surgery, swelling can block the urethra. Sometimes the nerves can take some time to recover, and the bladder muscles may be weak. And that's the key issue sometimes in a lot of these cases. Other issues like blood clots can be, found to be blocking the tube because you're having some bleeding. It drops inside the bladder and forms these big clots that can get stuck in there too. So all these things can cause issues. But one of the big issues is the bladder muscle. It's got to be able to squeeze the urine out even though you get rid of the blockage. So let's look at that a little bit. As you can see from the picture on the left, and let me see, I do have a little pointer here. So right here, this one here, you can see all that tissue. That's the obstructing tissue. That's what was causing your problem originally. Now, after the procedure, however we do this, the object is to scrape all that tissue out. Now, the prostate's still there. We can see it's right there. But this blocking tissue is removed, and now you have this big open channel. So all these procedures have the same goal in mind, and that's to remove the obstruction. However, that does not guarantee that you'll be able to urinate after surgery, as it requires a functioning bladder. Key words there. So what is the role of the catheter? So sometimes you'll go home with a catheter after surgery because it helps to drain the urine out most effectively. You don't want to be in retention because of the healing process. Most patients have it removed a few days, but some may need it longer depending on your recovery. The recovery timeline varies for each patient. Swelling after the procedure typically resolves in a few weeks, but nerve recovery can take longer. Now, your doctor may order a test prior to your surgery called urodynamics. That's a test to assess the bladder's ability to squeeze urine. Although this test is not always ordered, if your bladder is what we call atonic or hypotonic, which means it can't squeeze at all or it's very weak, you may not be able to push urine out, even though you've had an operation to open that pathway. So if urinary retention persists, sometimes they can try medications like you may have been on ahead of time, called these alpha blockers, to help to relax those muscles. And my favorite thing is intermittent catheterization, which I think is still the best option. Just putting a catheter in, draining your bladder. Now, you might think, well, how is the bladder ever going to get better if I'm just draining it with a tube? It's actually keeping the bladder what we call decompressed, so it's not stretching out, is the best way for that muscle to improve. So it's really the best option. It's just keeping the bladder kind of collapsed. Sometimes leaving a catheter in will have the same effect, but I think it's a lot easier to go through life intermittent catheter where you only have it in for a few minutes over having a catheter in 24/7, but you'll decide that. So after you've had surgery on your prostate, no matter how you've had it done, these are the kind of key warning signs that you should let us know about right away. If you have difficulty urinating, can't pass any urine, a lot of pain, or a fever, contact your healthcare provider immediately. These could be signs of a complication. In summary, urinary retention is a common but manageable issue after prostate surgery. Most men recover with time, but persistent problems should be addressed by your healthcare provider. So I hope that was helpful. I do get a few comments that people will send in now and then, and one of the things that I had heard quite a bit was, hey, I had prostate surgery and it didn't work. What went wrong? So I thought this might be helpful to kind of understand a little bit more about what's involved with this. It's a complicated system. Relieving the obstruction is pretty straightforward and not such a big issue, but most patients that have this issue didn't just get it yesterday. It's been going on for a long period of time, and the fact that it's happened for a long time has caused the bladder to weaken, so it doesn't have the strength to kind of squeeze anymore. I always say that, if you knew the muscle fibers of a bladder look like this, and as they start to get stretched out, they get like this, and it's harder for them to come back together and contract. Unlike a muscle like your skeletal muscle, like arms and stuff, where working them more makes them work better, overworking a bladder makes it get worse. So keep that in mind. You should stay, in touch with your urologist, especially if you start noticing some of these symptoms where you're getting up at night, the stream is getting slow, you're going more frequently. Those things could be a warning sign that your prostate is starting to get obstructed. Because if you wait too long and it starts to weaken the muscle, doing the surgery is not going to be the cure. So keep that in mind. And then we'll see you again next week.